Well, when the first batch of COVID-19 vaccines finally reaches this country, half of it will not be distributed immediately. This according to Health Minister Terrence Deyalsingh, who explains that Trinidad and Tobago will most likely receive the 2-dose vaccine from Moderna or Pfizer. Due to this, the minister says a certain amount will need to be stored in reserve, since the second dose would have to be administered in about 3 to 4 weeks after the first dose. Sunil Lalla reports.
The Health Ministry will be implementing a new vaccine distribution policy when the COVID-19 vaccines arrive in this country in March 2021. Health Minister Terrence Deyalsingh said as of right now, the quantity of vaccines to be shipped is not yet known, nor is there any information on which vaccine would be received. But he said based on current information, half of the vaccines would need to be stored so that vaccinated persons would be guaranteed the second dose.
Let's say I get 10 vaccines. After I administer 5 vaccines, I then hold 5 in reserve. So these 5 in reserve, when they come back 3 weeks from now, they are guaranteed their booster shot. If I don't do that, it means that first vaccine is wasted. And then we have to start over the process again.
Mr. Deyalsingh reminded that healthcare workers will first be administered the vaccine, followed by the elderly. Meanwhile, tender submissions for the building of the chillers at the Couva multi-training facility will be received and evaluated by next week. Mr. Deyalsingh said this will be installed by February, but it shows that there is space for vaccine storage should there be any need before this time.
If we get the Moderna vaccine, which is -20, we already have 2 -20 sub-zero freezers at Arima. The only thing that is missing logistically is the chiller that we have to build here.
He also assured that there are 4 -72 sub-zero freezers in place for vaccines that need to be stored at very low temperatures. Mr. Deyalsingh, though, had a stern warning to people that may be vaccinated to remain following the public health regulations.
The vaccine is not a silver bullet, in that it doesn't mean once you are vaccinated, you have to stop wearing this. You have to stop social distancing. No, you have to continue.
The minister was speaking at the Couva Hospital, where he paid a special Christmas visit to frontline workers at the facility. Sunil Lalla, TTT News.